What if I told you you could rewire your brain through electrical stimulation, through physical activity? What if I tell you I could look at someone walking and how they're talking and behaving and tell you which part of their brain is over or under functioning? And then I can give you some ideas of things to do to re-regulate, retrain that. So functional neurology is this field where it looks at how your brain works in your body. So for me, for example, I had a concussion when I was in second grade and had some migraines and stuff after that. But I've had problems hearing people. So if like a crowded room with noise, I have a hard time hearing people's voices, but I also have very bad handwriting. And those two things center in one part of your brain. And so I kind of learned through my functional neurology training that there's a link between my poor handwriting and my inability to hear people well, even though my hearing is normal. And so when I was doing my training, we started coming across the concept of functional neurology. And I started looking at my daughter. She has brain damage. She had a stroke before she was born. She has cerebral palsy. She had drug exposure throughout her entire pregnancy, resulting in functional blindness. Part of her brain called the corpus callosum that attaches the left part of your right part of your brain. How do you get that brain to start healing itself? And one of the things you have to do is realize where there's gaps in it and start stimulating those. And one of the issues she had because of that was tightness or tone in her legs. One of the things we learned is that you could actually use electrical stimulation to activate the muscles in her legs to actually tighten up, which will then activate your spinal cord and brain. And your brain will go, hey, I see legs there. So we're actually able to treat my daughter's tone in her lower extremities, which is this tightness. So just through electrical stimulation on her feet, through this foot plate that cost $300. Functional neurology taught me to start looking for stuff like that, to start looking for devices and start thinking in a different way that I wasn't trained in medical school. And part of what we talk about in Uncurable, From Hopeless Diagnosis to Defying All Odds, which is a book about my journey and my daughter's journey, is that there's so many things out there that have yet to be tried. And these are really safe things. What's the downside of a little buzzy thing on your feet? What's the downside of a buzzy thing on your tongue, which is the pons I've talked about, or putting someone in a bungee suit therapy to help stimulate their muscles? And the answer is there's not really. These are actually really, really safe things to do. They can have profound impacts on the right people. And that's the practice of medicine. The practice of medicine is taking up-to-date, current literature with the clinician experience and applying to the patient with their preference. Some people call that evidence-based medicine. I just call it good medicine. And so we talk about that in the book, but hopefully these little small snippets here will give you some ideas of some of the things I've learned in my career and some of the things I applied to my daughter that we talk about in Uncurable. And we have tons of free resources on our website, Uncurable Book. We have tons of free resources, the QR code in the book. Actually, we have thousands of dollars of free resources of things we're just giving away because we want people to realize what's out there and start taking care of themselves and having outsized, ridiculous outcomes. So take care. We'll talk to you soon.